All right, today we're jumping into a procedure that brings millions of babies into the world every year, but is often surrounded by a whole lot of questions. The cesarean section. We're going to break it all down, what it is, why it happens, and what you can expect every single step of the way.
So first things first, what even is a C-section? Well, simply put, it's a surgical delivery. The baby is born through cuts made in the abdomen and the uterus. It's done when a vaginal delivery just isn't the safest option for either mom or baby. Now, you might hear doctors call it an LSCS. That just stands for lower segment cesarean section, which tells you exactly where on the uterus they make the cut, and we'll see why that's so important in a bit.
Okay, let's dive into the fundamentals. What are the core things we need to wrap our heads around right from the start?
You know, not all C-sections are created equal, and the biggest difference is really about timing. On one hand, you have elective C-sections. These are planned way ahead of time, scheduled before labor even thinks about starting. A common reason for this might be if you've had a C-section before. But on the other hand, you've got emergency C-sections. These are unplanned and happen right in the middle of labor because something unexpected has come up, like the baby or mom is in distress.
So this brings us to a really big question. Why do C-sections happen in the first place? Let's get into the core medical reasons. While there's a long list of very specific reasons, you can pretty much boil them all down into three main buckets. First, there are maternal reasons, which are all about the mother's health. Second, you have fetal reasons. This has to do with the baby's health or maybe the way they're positioned. And third, there are placental reasons, which means there's an issue with the placenta's location or how it's working.
And here's a super handy trick to remember those categories. Just think of the 3 Ps. The first P is passage, which could mean the birth canal is blocked. The second P is passenger. That's the baby. Maybe they're in a breech position. And the third P is placenta, for issues like placenta previa, where the placenta is covering the cervix. It's just a really simple way to keep it all straight in your head.
All right, let's go inside the operating room. Now, this part can sound pretty intimidating, so we're just going to walk through it, step by step, to demystify the whole thing. Before a single cut is made, there's a whole flurry of activity to get everything ready. The team gets informed consent, they'll start an IV for fluids and meds, and they'll place a catheter to keep the bladder empty and safely out of the way. Then, they clean the abdomen really well, give antibiotics to prevent infection, and, this is so important, they check the baby's heart rate one final time right before they begin.
So, the surgery itself follows 6 main steps. It all starts with anesthesia, usually a spinal block so you're awake but numb from the chest down. Then comes the abdominal incision, which is typically that low, horizontal bikini cut. After that is the uterine incision, and remember that LS in LSCS we talked about? This is it, that lower segment cut. And then, the moment everyone's been waiting for, the baby is delivered. After that, the placenta is removed, and finally, everything is carefully stitched back together.
Okay, the baby is here, safe and sound. Now the focus shifts entirely to mom's recovery. And this part is just as crucial as the surgery itself. So what happens next?
And guess what? We have another easy way to remember the priorities here. The 5 Bs of post-op care. These are the 5 key things the medical team watches like a hawk after surgery. Bleeding, blood pressure, bladder function, bowel function, and of course, helping to get breastfeeding started. That very first hour after the surgery is absolutely critical. We're talking vital signs like your blood pressure and heart rate getting checked every 15 minutes. The team is also checking the uterus to make sure it's firming up properly, keeping a close eye on postpartum bleeding, and measuring urine output to make sure all systems are a go.
Of course, 2 other huge pieces of the recovery puzzle are managing pain and taking care of that incision. Pain is kept under control with medication to make sure mom is as comfortable as possible. At the same time, the incision site is checked over and over for any signs of infection. We're talking redness, swelling, anything like that, to catch problems before they start.
So you'll always hear doctors and nurses encouraging patients to get up and walk around as soon as they can after a surgery like this. But why is that such a big deal? What major risk does it actually help prevent?
And here is the answer. It's all about preventing a very serious condition called deep vein thrombosis, or DVT. Getting up and walking, what doctors call early ambulation, is the #1 way to stop dangerous blood clots from forming in your legs. It just gets that blood circulating properly. It's so important. Okay, let's be real, no surgery is completely risk-free. So for this last section, we're going to take a really balanced look at both the pros and the cons of a C-section.
Look, the main advantage is impossible to ignore. A C-section can be, and often is, a life-saving procedure for both mom and baby. But on the flip side, you have to remember it is a major abdominal surgery. That means it comes with a higher risk of things like bleeding and infection, and for sure, the recovery time is a lot longer than with a vaginal birth.
And digging a little deeper into those potential complications. For the mother, the main things to be aware of are hemorrhage, infection, and that DVT we just talked about. For the baby, sometimes there can be temporary breathing issues or a lower initial APGAR score, which is just that quick health check they do right after birth. It's all about weighing these risks against why the surgery is needed in the first place.
We have covered a ton of ground here. The why, the how, the what happens after. But if there is one single thing that the entire medical team is watching for most intensely right after the surgery, what is it?
Let's just cut right to it. Of all the potential issues, of all the things that could happen, what is the number one most critical complication that everyone is on high alert for immediately after a C-section? Hemorrhage. That's it. Excessive bleeding. It is the most immediate and serious risk after the surgery is over. And that is why checking those vital signs and the uterus so obsessively in that first hour is completely non-negotiable.
You know, this quote really sums it all up, doesn't it? A C-section is a major surgery, but at its core, it saves lives. And the more you understand about the whole process, the more empowered you can be on the road to a safe and healthy recovery for everyone.
And that's our deep dive. So I'll leave you with this to think about. Now that you've seen the whole process laid out, what part of this journey was the most surprising to you? What was totally different from what you might have pictured? Thanks for joining me.